All right, everybody. Thank you so much for joining today. So today, going to talk about a really neat peptide called BPC 157. So we'll just kind of hop right into this. For those who may not have seen my any of my other content, I have a decade of experience in the emergency department, so very much reactive medicine, but also built health and wellness optimization clinics. So on the preventative side and health and wellness side. So kind of have foot in both camps in those regards. And so we'll just kind of hop into it. This is a really interesting one. So the reason I got a rash on here is this is someone fairly recent. They actually came in one of our clinics, and they were given for a long time some incredibly high doses of steroids to the point where it caused a pretty significant entire body rash. It's where dermatologists were calling it steroid-induced dermatitis, where basically had some pretty significant redness and swelling that was going on through his whole body and led to certain infections, especially in like the pores and follicular areas where like the hairs kind of come out kind of area. Typically, it's healed fairly well with some antibiotics, sometimes like doxycycline or something like that. Depends on the dermatologist and obviously, the physical assessment with that. But this gentleman in particular had this rash for quite some time, for several months. And he had been to multiple specialists, including multiple dermatologists who took skin biopsies confirming that that's what this was. But he was started on multiple regimens, combinations of medications to help kind of calm it down and antibiotics, and nothing was really helping, to the point where even the specialists at high-end hospital facilities were just saying, we don't really know what to do for you. They had ruled out that he had a very extensive workup, so they ruled out that it was anything severely life-threatening, but clearly it's very uncomfortable, and this gentleman was suffering, although not life-threatening. So, which is, typically the main concern there. So essentially came in and started him on BPC 157. For this individual, actually did oral capsules, gave him a little bit higher dose, and within a matter of less than a week, his redness and swelling had significantly gone down. So that's a unique situation where it helped a good bit with that. So we'll continue hopping into it. So big thing, disclaimer, just like anything else, these are, I'm not providing medical advice by any means, just kind of sharing some educational information and some stories from individuals that I know firsthand have utilized peptides, as they are considered research at this point in time in the United States. By the end of this video, should know what BPC 157 is, how it can help you, and how to take it. This is the compound of how it's structured and how it looks. It is a 15 amino acid peptide. It's found naturally in the stomach. It's really good at helping the body with reducing swelling and pain. And that's systemic, like it, through the research that's out there, it shows to be a systemic process throughout your entire body, but it definitely also, if you have in some of the studies, there were particular ailments that were taking place. For example, one showed rats with arthritis, and it tackled and helped a good bit with the arthritis. So it can tackle specific areas as well, but it kind of goes through the entire body, and it protects cells in the stomach and the intestines. How does it work? Number one, tissue repair. It helps cells grow faster, improves blood flow, supports the immune system. It helps with something called angiogenesis, which basically means it helps to grow new blood vessels, Think of this as little tiny highways that deliver oxygen and nutrients throughout your body, which is super important for the healing. It helps with anti-inflammation. It fights off swelling, so less pain and faster recovery period. Um, it also helps with gut health. It protects the gut lining. It helps with ulcers, especially gastric ulcers. It helps a good bit with and reduces inflammation. Conditions like IBD, which is inflammatory bowel disease, and also IBS, inflammatory bowel syndrome. Um, it also helps with wound healing. It accelerates healing in various wounds like skin, muscle, tendon injuries. Um, and there's potential, there's strong correlation with helping with muscle repair and neuroprotection, and protecting your blood vessels and your joint health. So it's been studied in the United States since 1991. There are definitely earlier studies that take place, especially in Russia. Russia is pretty progressive with utilizing peptides, so there's earlier research, but in the United States since 1991. And there was a study published in 2012 that found that BPC 157 accelerated wound healing in mice. A study published in 2014 found that BPC 157 reduced inflammation in rats with arthritis. And a study in 2016 found that BPC 157 protected against tissue damage in mice with sepsis. And sepsis is essentially when an infection is throughout your entire body and you start having some organ issues. So it helps protect with tissue damage that. So what is BPC 157? It is a peptide found naturally in the stomach, and it can help with healing and gut health. How do you take it? There's no established dosage guideline for BPC 157 research because there hasn't been a lot of published research on the drug to date. The general rule of thumb, as in any medication or peptide, is to begin with the lowest dose feasible, because it's crucial to use the lowest effective dose in research applications. And again, this is a research peptide. Common dosage based on the clinical studies and clinical data that's out there. So that's where this kind of comes in. So the typical ones based on clinical research that's out there is 250 micrograms, not milligrams, but micrograms. So that's very important to distinguish those, because it's literally a tenfold difference in the dosage. So 250 micrograms injected subcutaneously twice daily, or there's capsules that come in 250 micrograms. You can take one or two capsules a day. So for my example at the beginning, that gentleman with that rash, actually gave him 2 capsules daily. So that was a total of 500 micrograms. But you start low. We started off with 250 micrograms for the first few days, and then increase that just to make sure that everything was tolerated well. Duration, how long you should take it, usually a 21 to 28 day cycle. So 3 weeks and just shy of a month, or all of February, depending on which month you're in. Potential side effects, injection site reactions. Sometimes you can get some flushing, some nausea, and some headaches. And it works really, really well when combined with TB500. When you're talking about a healing and immunity stack, or recovery from an injury, or even from surgery or something like that, TB500 combined with BPC 157 is a great combination based on the research that's out there. Again, this is kind of going over subcutaneous injection, because based on the clinical research that's out there, the most common dosage from what's out there is 250 micrograms injected twice daily subcutaneously, or you can take the capsules once or twice daily as well. Limitless Biotech is a great place to get it. I know the owner personally. Quality control is a ginormous, is priority number one for them. So they're very transparent on their website. They provide third-party testing, and they even give you can see in the results down here on this one on the far right, pictures underneath. They have the third-party testing results, because transparency is the key portion of that. With everything being produced here in the United States. So this one on the far left is the injection version, where you get that BPC 157 in the vial that has to be reconstituted. In the middle is the capsules, and they're 250 microgram capsules. And then on the far right is actually a fairly new one they have, that's actually a nasal spray. And they've made it just as bioavailable as the other methods. And it's BPC 157 combined with TB 500. So that says thymosin beta 4. I go over this in my TB 500 video. Thymosin beta 4 is the natural produced way for thymosin beta 4. TB 500 is an exact copy of thymosin beta 4 or TB4. It's just that TB 500 is synthesized, it's made in a lab, where TB4 is the natural formation of it. So, but they're similar compounds. So this is automatically in a nasal spray version, BPC 157 with TB 500. So that's your max benefit combination right there, in a pretty easy way to administer it through a nasal spray. So again, back to our slide on what we need to learn by the end of this video. What is BPC 157? It's a peptide. It's a 15 amino chain peptide found naturally in the stomach. How can it help you? It can help with healing and gut health. And how do you take it? 250 mics. Sorry, that's medical lingo. 250 micrograms twice daily, subcutaneously, or tablets. You can do 1 to 2 tablets daily. And again, rule of thumb for anything research, any medication is start low and go slow. So pop quiz. A benefit you might expect from BPC 157 is A, muscle repair, B, stomach and digestion issues, C, surgery recovery, or D, all of the above. The answer is D, all of the above. What is BPC 157? A, it's an antioxidant extracted from fruit. B, it's a probiotic and prebiotic. C, it's a peptide found naturally in the stomach. Or D, it's an essential mineral. The answer is C. How much does BPC, how much BPC 157 should you take based off of recommendations from the clinical presentation that's out there today? A, 250 micrograms twice daily. B, 1,800 milligrams once daily. C, as much as it takes to heal. And D, 500 micrograms daily. The answer is A. Please reach out with any questions. Something to clarify, I forgot to put in this slide, but I'll make sure that it's out there as well. As we talked about, you typically use, per the research study, typically use it from 21 to 28 days and take an equivalent amount of time off. That usually is enough to do it. It's not typically something that you have to cycle on a bunch of times. But if you're in this recovery phase, you say take it, okay, I took it max 3 weeks, 21 days, take at least 21 days to a month off. And then if you're still not quite, healed to where you need to be or want to be, then you can start cycling back on there. Typically, one cycle does a pretty good job with it, but cycle, be off of it for as long as you were on it at least. All right. Thank you very much, guys. Thanks for joining.